Our presentation is on uterine transplantation, and it's by Justin and Pearson.
Okay, guys, so what is uterine transplantation? According to Jones and Sayso, uterine transplantation restores reproductive anatomy in women with absolute uterine factor infertility. So that could be anything such as a congenital disease from a hysterectomy due to uncontrolled postpartum bleeding or anatomical or physiological defects such as malformations. The uterine transplantation allows for the opportunity to conceive, experience gestation, and for the woman to acquire motherhood. There is also, with uterine transplantation, it can also be done either with a deceased donor or a living donor.
So why is this an ethical issue? So first off, we're not only concerned for the receiver of the transplant, but also the fetus, since the fetus is involved. The fetus can't really weigh in on like how this is going to overall affect its life. And yes, a child will be produced from this, hopefully, but we do not know the quality of life that child will come out with. The psychological impact on both the receiver and the potential child could be potentially really bad if the results come out negative and the child has a lot of negative impact from the procedure. Also, the transplant is not a vital procedure, such as like a heart transplant or a lung or a kidney. Uterine transplant isn't necessarily needed and kind of a risky procedure. So pros and cons for the uterine transplantation.
So the pros of uterine transplantation, like Pearson said, it's not always successful, but if and when it is successful, the woman does have the ability to give birth to a child. Like I mentioned earlier, they can use a deceased or a living donor. And the advantage of using a deceased donor is that there's no harm to the donor. And although there is no benefit to the donor, it improves the quality of life of the recipient. As far as with a living donor, it can cause harm to the living donor. However, the psychological and emotional benefits for both the recipient and the donor outweigh the the downside.
So some cons, this is an elective procedure. However, there are risks to both the donor and the receiver. We don't really exactly know the science. This is kind of a newer procedure completely. And so we don't know how the outcome will affect the newborn. In past studies and trials, newborns usually come out premature from this procedure. And it's not recommended to have more than one fetus with the transplanted uterus. So majority of the time, once they have the first fetus, they'll have a hysterectomy directly after. So you only get one fetus out of the uterus that's being transplanted. Medical issues, of course, organ rejection. The mom has to take immunosuppressants so that the body doesn't completely reject the uterus. So that also causes birth defects in the baby. And because of this, the recipient, so the mother, is also at a higher risk for preeclampsia and hypertension, which can have both a negative effect on her and the baby overall. And these are our references.
Thanks, guys.